Hi folks, Dr. Omar Balia. Welcome to Cancer Healing Vlogs. So it's a Sunday and it's been a relaxing day, and I wanted to still upload a video today. And the topic I'm thinking for today's day, as you have seen already in the title, is what is the importance of biochemistry in pathology? Often less talked about topic in pathology is biochemistry, surprisingly, even though it's a completely different subject. You've studied it in the first year of MBBS and pathology is in the second year. But actually, some very less talked about things are also that biochemistry often, at least in India, I know the scenario is like this, and I'm sure worldwide also to some extent similar pattern must be there, that almost 80% of the revenue for a pathology lab is generated by biochemistry. Now, you doing MBBS, studying about biochemistry and all those things like cycles and understanding where which molecule goes where in which part of the body and how does it act and its importance, you may not relate as much to it in pathology just from that sense. But when you look at it from every test that you do, like a screening test or a yearly annual exam, it is going to have, let's see which ones, lipid profile, RFT, that's renal function test, LFT, liver function test, or all of that is pretty much biochemistry. That's the bulk of it. Of course, electrolytes, sugar, all of that comes under biochemistry, which is pretty much 80% of your tests. And yet, in residency, we don't end up concentrating a lot on biochemistry anyways. But in practice, you may end up as a pathologist signing off plenty of biochemistry reports if you choose the path of hematology biochemistry, and if you choose the path of histopathology and the FNACs. If that is what you want to concentrate on, you can do that, because if that's what your interest is, you can do that, take that route. Financially speaking, they both more or less come the same. Oftentimes the biochemistry hematology side may tend to earn a little bit more, but it's basic. I think at the end of the day it evens out. So if you're really interested in anyone, you can enjoy it and just go forward with it. All these facts are just based on my little understanding of the few interactions I've had and few things I've seen in my experience. And you can of course see based on what you have experienced and decide accordingly. Then when we're talking about biochemistry, there is also a very important part of it is the quality control, which is got an intense amount of daily checks, twice daily checks, sometimes thrice daily checks. Mostly it's twice in big labs. And you may sometimes run out of TAT, that word TAT, an important word which defines the lab, how serious. That's another thing which you may come across often during your residency TAT, but during your practice that word gets even more emphasized, especially in a corporate practice. Now when you're talking about a medical college, yes, there is importance of that, no doubt. However, you don't end up concentrating on the NABL aspect of it as much, at least it may not be touched upon as well, but you certainly will be taught the basics of it. But when you're running, if you may start your own lab or you work for a big lab and you're in the hematology biochemistry side and then clinical pathology also. So like I said, biochemistry being the bulk of it, and the second highest bread earner in a pathology lab is plain CBC, MP, Vidal, urine routine, these basic tests which is kind of microbiology. When you talk about Vidal, urine routine is the clinical path, as you know, and CBC, of course, the bread and butter base. CBC MP is in the hematology side, that is actually the next highest demand. Then when we go into the specialized tests like histopathology, and then we're going to go even advanced like flow cytometry and genetics and molecular, as of right now, it is it may be slightly more expensive of a test, each of these tests I just mentioned right now, and from slightly to quite expensive. Still, they may not be very like they may not have as much of a like the workload, but since they anyways take time to do, it takes your a good part of your day, the entire day pretty much as what you would get in hematology. Say you get 20 cases in hematology in general, you may get 3 cases in histopathology, but the time may take maybe, in fact, 20 in hematology gets over much sooner. You may need 150 to match up to maybe 20 of histopathology. That's not as relevant, because it's, of course, I've just given a very generalized statement here. But you get the idea that how, like, just the ratio of the workload. And biochemistry also is very there's this point about it which I wanted to recall. I'm trying to remember. Anyways, overall, it is going to be a very crucial part of it. You may want to pay attention to all the things that you're studying in biochemistry. You may not even relate to it right now. If you're planning to join pathology or you're a pathologist, these things are going to be relevant, because when you explain what the findings are to a patient or to your clinician, and you correlate them and advise them a certain test, you need to have your basics cleared. And yes, this other thing that I wanted to say about biochemistry was that sometimes even that also has advanced tests, and those are very expensive ones, and they may take time, where you go into like those ratios and trace elements. Those are rare ones and they're more expensive. Maybe it's the supply demand, possibly. Either ways, that's what the basic importance of biochemistry in pathology is. Yes, one more thing. Some hospitals may end up having a specialized biochemistry department only. Like, I'm talking about corporate. Medical colleges also the same. When we talk about corporate, this may lead to the biochemist taking care of all these lipid profiles and all the basic the bulk of it, and then there may be the hematology section. So of course it kind of divides the workload, and one patient sample gets divided into 3 different places, 4 different places, and then they go into different departments. That's just some basic overview and some idea for someone who's exploring biochemistry and also understanding how it's important in pathology. Hope that helps you with some insight down the line. Right now, say where, liberate self, like and subscribe. I just want to, in this video, I want to talk about why am I talking about say where. It was just something with my channels. I decided that I want to talk about say where, and there was this save soil movement that was going on by Sadhguru, and I was like inspired by it. I was like, all right, let's just make one for save air, one for save water, and one for save soil. Why just only soil? Let's do for the other ones as well. Just an intention. I intend to continue with this. Just by mentioning that, how do you save air? I don't know. You use your logic, you use your intelligence, and you know what needs to be done. Whatever way you can support it. All right. Thank you very much. Like, subscribe, comment. Cheers. Bye.